Good afternoon. I am Melissa Toledo Ontiveros with Constellation Consulting. We are pleased to present the New Mexico 2021 Summit on Health Equity. The summit is funded by the New Mexico Department of Health, Tobacco, Use Prevention and Control Program, and will take place throughout the month of May on our event app with live sessions each Wednesday afternoon. For more information about the summit, please visit our website at newmexicohealthequity.org. Due to COVID-19, this year's Summit on Health Equity remains an online event. We appreciate those who have participated and supported this year's event, including the New Mexico Department of Health, our Summit Planning Team, Presbyterian Health Care Services, Con Alma Health Foundation, Be Well New Mexico, the Santa Fe Community Foundation, and others. For a full list of our supporters and online exhibitors, please visit our event dashboard online or on the HOVA app. I also encourage you to utilize this year's Summit on Health Equity event app. The HOVA app provides you with opportunities to network online, schedule COVID-safe meetups, create discussion groups, visit our exhibitors and supporters, watch recordings of sessions you may have missed, download files provided by our presenters, and much more. It is a great tool for you to use not only during our live sessions, but also throughout the month of May. Plus, when you use the app, you can earn points and prizes. Please check out the leaderboard in HOVA for more information. For our session today, attendees' webcams and microphones have been disabled. If you have questions for today's presenter, please use the Q&A function within HOVA, and we will address as many questions as time allows during the Q&A. Also, any materials provided by today's presenter will be posted as part of the session within the event app. Following today's session, we appreciate if you take a few minutes to complete our session feedback by clicking right in the session of the HOVA app. If you'd like to request community health worker or social worker CEUs or continuing medical education units, please include your name and email address on your evaluation. And CEU certificates will be emailed out within 60 days. If you need assistance with CEUs, please email us at info@constellationnm.com. If you need assistance during the session, please utilize the Q&A feature or ask the organizers feature in HOVA. You may also try emailing us directly at info@constellationnm.com. And finally, before we begin today, Constellation Consulting acknowledges that our organization operates primarily on the unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black, Asian, and Pacific Islander communities, with whom we stand in solidarity. We are New Mexico, and we were built strong by the diverse people of our communities. There are a variety of organizations supporting health equity throughout our state. We have listed just a few here and encourage each of you to seek out, learn more, be involved with, and support organizations who are building a better New Mexico for us all. Today, we are excited to host Kristen Carmichael. Kristen is a former healthcare and social service executive, published author, and independently licensed social worker with 20 years of experience working on the front lines with high risk, high reward, complex patients. Kristin now partners with forward-thinking clients to engineer programs and coordinate communities to proactively address social determinants of health and health equity challenges. You can read all of our presenters' complete bios in our event app and on our website at nmhealthequity.org. Please welcome Kristen Carmichael. Welcome. You're on mute.
Well, okay, let's give it a second try. So thank you, Melissa, for the kind introduction. I'm very happy to be here today to talk to all the participants about resilience and about how even in these really difficult and challenging times and difficult and challenging jobs that you all hold, that we can avoid burnout and create long-lasting sustainability for our careers. And kind of hold on to that hope and joy and excitement that probably drew you to the work that you're doing now. It's my objective within this presentation to really just give you the time and space and information to bring awareness to the issue of resilience and hopefully give you some new ideas, some new concepts, new information on how you kind of conceive of your own resilience within your career, and some real concrete strategies if there are times where you're struggling or having a sense of burnout or feeling really overwhelmed, which I gotta say is pretty normal these days, and certainly something that I personally have felt as well. So let's jump into this information. Also, a little piece about this presentation today, I've tried to infuse some humor into the material we're going to cover today, because it is heavy to be talking about burnout and vicarious trauma and some of these concepts we're going to be discussing today. So I'm trying to lighten it up a little bit in the spirit of creating resilience even within this presentation. So away we go. Another kind of preamble before we jump into the more intense content is just, again, expressing that challenges around burnout or challenges around chronic stress, especially considering the 1.5 years that we've just had, are really normal. And it's something that I keep an eye on a day-to-day basis, and something that I've struggled with in my career. I know early in my career when I was doing direct service, boy, I sure was suffering from burnout and way past my prime before I figured it out. And so hopeful to pass on information to you today that can help you from maybe finding yourself in a similar circumstance. And then also for us to kind of all acknowledge at the beginning of our time together that many of the jobs that we're doing are not quote unquote normal jobs. And what I mean by that is, the work that you're doing to improve society, to make this world a different kind of place, a better place, regardless of the role that you're playing in order to make that happen, that's a very intense thing, particularly now. And it is different than, say, I'll give you an example. My husband works at the Los Alamos National Lab. I'm presenting to you from Los Alamos today. And when his workday is over, his workday is really over. Similarly, say you were a CPA, or you did construction, or you were a pilot. Now, those are jobs that come with their own unique challenges. But I think it's important for us to also recognize kind of the occupational hazard, if you will, of the work that we're doing, of being so close to these issues that matter to so many people, of witnessing grief and loss, that can really take a toll on us. And that in the same way that somebody who paints a house has the occupational hazard of falling off a ladder, we have a vulnerability by virtue of the work we have chosen to do, and need for protection, whether it's us protecting ourselves from the harms that can come to us and hopefully with a partner and our employer who also wants to work with us so that we can kind of have some stewardship over this experience that we have within our careers. All right. So here begins some of the humorous slides, but we're going to work our way through talking about kind of the nervous system and how we can look at having a more balanced nervous system, what it looks like when the nervous system is out of balance and dysregulated, and the impacts that that can have. And then we'll work our way through kind of how the public health crisis of COVID-19 has exacerbated a lot of the chronic stress that folks are feeling. We're not going to spend an awful lot of time on that subject because I know you're already experts on the topic. Frankly, you've been going through this for the past year and a half. And so then we're going to dive right into thinking about, what are some personal strategies that we can use and that you may already be using, as well as what I call work smart strategies. So those are strategies that you can use specifically at work. And then we'll conclude our time together by talking about what employers can do to meet employees halfway and create workplaces where resilience is something that's acknowledged as being needed, and then also supported in really strategic ways. Because us being resilient to what we're experiencing isn't something that just happens. It's something that takes forethought and work and planning. And certainly there are ways that employers can help their staff kind of ride these waves better than perhaps what other employers are doing. So we'll get into that kind of at the end of the presentation. All right, so back to the nervous system, and starting off with a few terms, a little bit of terminology. Each of these, all of this language is used to describe kind of work impact concepts. And a lot of times folks use them interchangeably, but they are not the same thing. So chronic stress is certainly something that we've seen an awful lot of in the past year and a half. And even prior to that, I mean, many of the jobs that you all are working in that are involved in social services or public health already had a really high kind of chronic stress load, if you will. And then thinking about secondary trauma, which pertains more to if you're witnessing or attempting to assist someone who has experienced a trauma, then trauma can be seen as kind of radioactive, in that just even being around someone who's experiencing that can have real impacts on you, particularly over time. And if you are witnessing or providing services over and over again to folks who have had something tragic happen to them. Compassion fatigue is more about working in a role where you are asked to empathize and where you are asked to work with folks who are really struggling, and you're needing to do that over and over and over again. Hence the kind of fatigue part of this terminology. And then burnout. And so burnout's a little different in that burnout can happen within any job, whether you're working with folks who are more marginalized or whether you're witnessing any particular injustice. So burnout is not kind of exclusively something that happens within helper positions. It is something that is a result of chronic stress, and something that I see an awful lot of folks struggling with these days, again, given what we're all going through. Okay. So this is an example of a really happy nervous system. And you can see that it's kind of like a rolling wave. And in every life, there's going to be, there's going to be troubles and tough points, but we all have what's called a resilient zone. And that's a zone in which we can accommodate what's happening around us, and we can flow through it, even if there are some tough times. And, some folks' resilient zone might be a little heftier than others, depending on what your early childhood looked like, or genetics, or, for all different kinds of reasons, we may have different resilient zones and be able to process different things better or differently than other people. And so this is really kind of what we're shooting for when we talk about resilience and keeping people away from burnout. And then to contrast kind of the rolling waves that you saw before, now we have this really dramatic slide that shows what happens when there's a traumatic event or a trigger that pushes you outside of your resilient zone. That could be any number of things, but even being around people that are dysregulated or imbalanced in this way can have really intense impacts on you emotionally and physically. And it tends to be that if you're around folks that are feeling this way, you can take on some of those same attributes within your own nervous system. And the reverse is also true. If you can bring a really balanced nervous system into a crisis situation, that can help calm other people around you. One more piece about this slide is, if we were, and follow me here, if we were prehistoric people and we were out and kind of roaming around and gathering our lunch, and we saw a saber-toothed tiger, that is when we might go into this type of nervous system, and we could have a fight, flight, or freeze response. And that would be normal given the extraordinary circumstance we're in. And that's a protective thing that our body does. It's part of our evolution that we've been able to do that. And if the tiger doesn't get us, then what happens is over time, we should go back into that resilient zone. And what I've seen through the pandemic is that we haven't been able many times to get back into our resilient zone because the hits keep coming, if you will. There's been so much uncertainty and so much fear, and so many, actual bad things have happened that, for me at least, and I don't know if this is true for you, it feels like just the second I'm getting close to getting back into that resilient zone, then here comes another, really scary thing. So I know that's something that a lot of people are grappling with, and it certainly can impact not only us, but the people around us, our family relationships, our friendships, and our ability to work and do things productively. And one other piece about this very dysregulated nervous system is that when folks are in this sort of a state, their ability to be flexible or creative or hopeful is really impaired. And so if you have jobs that ask you to kind of work in a gray area, or again, exert a lot of creativity, or it can be hard at times to keep hopefulness in the face of everything that you're seeing, this can certainly have an impact on that. And it does seem like in my professional career, whatever office I've ended up in, there's the one person who has been dysregulated for so long, and they've become so negative, and you can just see it all over them that their career has really taken a toll on them. And so I think I have been that person before. And again, I don't want you to have that experience. And there are things that can be done to keep you from being that like really dysregulated person who's now very jaded and upset, and can't wait to tell you about it. All right. And again, this is the part we're going to cruise through kind of quickly, because I think you know what we're up against. You've been feeling it. You've been living it. It's been your everyday. But again, just particularly during this pandemic and even before, there were an awful lot of stressors when you're involved in work. where you're attempting to change the world or help people or create more equality. And with what's been happening the last year and a half, now there's these added issues. And so how have you been able to navigate that? Have you been able to navigate that? And what does it look like as we're starting to turn the corner? And I'm almost afraid to say we're starting to turn the corner, but it seems like we may be. You know, where does, if you've developed some hypervigilance or some overworking behaviors, you know, how do you even think about reining any of that in? What could that look like for you? What are the advantages and disadvantages of how you've had to evolve in your workspace to make it through this last year and a half? Those are tough questions. And honestly, there's no easy answers. They're all very personal and take time, I think, to sort through. So this slide, it is a little bit of a tributary from the presentation, but it's something I've been thinking about and I wanted to put in front of you. It is comparing how many of the changes that happen during the pandemic, many of those impacts, whether they be the isolation we've felt, kind of the insecure supply of things that we may have needed, the unpredictable nature of the future, our inability to protect the ones that we love, how those things mirror so similarly many of the populations of the people that we're working with or working on behalf of. So obvious kind of overlaps with domestic violence survivors who often find themselves unable to keep people safe in their home, and feeling isolated and feeling like their basic needs aren't getting met. And for these other populations as well. So seeing a little bit of an opportunity here for us to understand that as dysregulated as we may have been this past year and a half, given the conditions going on around us, our clients, the folks that we're working on behalf of likely have felt that and more. And so, what we've seen from ourselves, I have oftentimes seen from folks I've worked with, as far as their, difficulty in executive function, difficulty in long-term planning, difficulty in trust, having trust with folks. So anyway, I wanted to put this in front of you as a way to think about, if this happened to us and we had these results for ourselves, how commonly are we seeing that in others and not recognizing it for what it is? So then this is also what we're up against. These are many of the symptoms that can occur if you are kind of headed down the road to burnout, or if you are kind of battling with chronic stress, or lacking a certain element of support that you're needing within your career or within your life. And again, in this spirit of kind of a judgment-free hour together, let me just say that I have felt at different times probably every other one of these. So in looking at these different symptoms, just know it's not that we want to avoid ever feeling any of these things. I think that's unrealistic. But giving yourself the space and time to think about how often they might be happening. Are they escalating? What impact are they having on you as an individual, on your family, in your home, at work? Are they escalating? Are they declining? And are you okay with that? And so what I mean by that is, I think within every kind of employment situation, we strike up a bargain, and that bargain includes maybe you're going to feel some of these things some of the time if you pick a career like the ones we have picked. And there should be limits where your limits are and how you navigate them to hopefully bring yourself relief or kind of back off the throttle when you need to, can be a difficult dance. But I wanted you to be aware of these symptoms. I know, I have felt them particularly early in my career, and I didn't have the education or training to know why they were happening exactly. I knew it was related to work, but I couldn't make all the associations I needed to be making really good decisions for myself. And so, sometimes knowledge is half the battle. Okay. So now we're going to talk a little bit, we're going to go ahead and jump into how you can build resilience. So this is kind of the active part. We were talking about, what your nervous system looks like and how things can get out of whack and what that looks like when it is happening. So this is, I think, the really hopeful piece of the presentation where it's like, okay, I know these bad things can happen to me, but what do I do about it? And this is the what you do about it part. And I feel for Nicolas Cage in this meme because I have so been there where you're just like at the limit of what you have left. So one shift that's happening in folks thinking around resiliency is, and you'll see in this first quote in the gray box, the American Psychological Association kind of talks about resiliency as being this ability to bounce back from something that has harmed you, an adversity or a tragedy. And then in the two other quotes, there's now this concept of not only bouncing back, but bouncing forward. So how can you use these difficult times in order to create more strength and for them to be a catalyst to kind of propel you forward? And not to be too Pollyanna about it, because sometimes a really hard day at work is not something you're going to transform. But could your overall experience, are there some ways to transform your overall experience so that you come out the other side kind of better, stronger, more compassionate, more thoughtful, more understanding? And I certainly have seen a lot of folks in helping professions end up that way. And that's certainly the way I'd like to end up. So there are three critical factors to how you prevent burnout and kind of choose resilience for yourself. And again, many times it is a choice. We make hundreds, if not thousands of decisions every day that lead us on a course one way or the other. And on a course to having more kind of enjoyment and stability and stewardship over our experience at work, or toward perhaps feeling more stressed out, feeling more burned out, feeling less hopeful. And I'm not trying to tell you that you fully control all of that, but there are some choices that you and I are making every day to create more of a chance for one or the other. And so I have this kind of pink arrow going across your work behaviors and your employer's response, because really in thinking about how do we avoid burnout at work, it is those two pieces of the puzzle coming together. I see the employee having a 50% responsibility in creating those kind of conditions, and then employers also having a 50% responsibility, and that being a partnership to create the kind of conditions necessary that folks can thrive at work and not be harmed by their work. And let me just say that many of the jobs, social work or public health, tend to be young people who grew up in families where the kinds of things they're battling against were happening. So I think it is particularly incumbent upon us as people in these professions to protect what was once, a young person who experienced these harms, who are now looking to do something productive to resolve them. And all too often I see where these careers can kind of eat their own. And what I mean by that is that I see too many organizations and agencies where there isn't a solid support network built in thoughtfully, so that folks really can grow and thrive within these careers. And what you see instead is that folks will turn over in any particular role or position every 6 months, year, 2 years, and they're done because they're burnt out and their hair's on fire, and it's too late at that point. So these are kind of the different critical factors that have to come together in order for there to be that good, strong foundation and the kind of support that folks need. So it's your behaviors at work, your employer's response, and then what's happening for you outside of work. And we're not going to get too much into that bucket today, but suffice it to say, if your personal life is awfully stressful and seemingly out of control and overwhelming, and then you have one of these more difficult emotionally jobs, a job where there is emotional difficulty, that's usually a really bad recipe. So trying to keep all of this in balance it's tough. And it is also worthwhile because if these components are out of balance, if you are out of balance, again, who does that impact? I sometimes see people who think they're just gonna kind of gut it out or really just get through these tough times by white knuckling it. And it not only hurts the individual, it always impacts their work and their ability to do good work. And it commonly also impacts all the people around them. So it's kind of this ripple effect when you give and give and give and you're beyond where you should be. So in thinking about kind of the advantages and disadvantages of, again, gutting it out, can that be done for a short amount of time? Yes. But then you have to start thinking about what those ripples are that are being created in your life and other people's lives. Okay, so now we are talking about the personal strategies and looking at what you can do. This one always cracks me up. What you can do in order to support your own resilience. So this is a super basic graphic, but just showing that as stress bears down on you, when you have more stress, your support has to go up in a corresponding way. And again, a super simple thought, but really hard in actuality. And I even find myself, when times get tough, I want to kind of buckle in and just work harder and kind of stay within myself to make something happen. And that's really the opposite of what you should do when you're dealing with tough times like these. So how do you recognize when you're up against it and times are tough and stress is headed your way, and then kind of recruit the amount of support that you need to push against that so that you end up, again, with that nice, healthy, balanced nervous system? And so these are some resiliency builders that either I've used or I recommend. And you all have these. So I wish we were in person, and one day maybe we will be, but just thinking for yourself now what you do with, do you like to bicycle? Do you run? Do you have a favorite meal that you can make for yourself? Do you have a hammock? I've been doing some serious hammock time on the weekends. Are there things that you're grateful for that you can remind yourself about? Thinking about the purpose that you're serving with your work sometimes can refocus on something more positive than the overwhelm. A sense of purpose can be so important for getting through tough times. Any hobbies that you have, all of that counts. And it may seem like little stuff like gardening or who knows what. But when you're going through these difficult times, again, the impulse is to kind of go inside yourself and work harder. But really what's called for is to bring in these supports that you have. Now, this isn't even kind of naming the people in your life that you may have as supports. And so I've created kind of this makeshift resiliency plan. And, you can take a minute right now and think about some of these questions, but, on a regular basis, what are the things you're doing to kind of stay even, to meet the challenges in your life, to still feel enthusiastic about waking up in the morning, and to be committed to those things, that you're not going to skip your exercise break every day, or you're not going to let work interfere in your time with your children. That is kind of a hard no for you. I mean, knowing those things and then doing those things are really important. I know I have a friend who once worked for Child Protective Services, and she said, just because someone has neglected their child doesn't mean I'm going to neglect mine. And I thought that was such a powerful statement of a hard boundary that's not to be crossed. And so thinking about what those hard boundaries are for you. Also thinking about the second question on here, I know times are getting tough when. And so we looked at some of those symptoms that can arise, but for everyone it's different. So for me, I'll tell you what my recipe is when I know I am kind of over the moon and too stressed. My eye will twitch, I feel anxious, I get upset stomach, and I can't sleep. And I know if those things are happening, I have got to pull back and I've got to increase my supports, and I'm out of balance and I'm not doing my best work, and I'm not being the best I can be for the people in my life. So for you, what is that recipe? What is that red flag so that you know when it's too much? And then kind of knowing when times get tough, who can you call on? What can you ramp up more of or decrease some of so that you can find that balance again? And then this last piece, which we've talked about a little bit already, is just what are your hard no's? What are the things you're not willing to sacrifice for work? And kind of having that internal discussion with yourself of where is it too much? Because what can happen over time is, you stay 15 minutes late for work, and then you stay 30 minutes late for work, and now you're staying an hour late for work. And it used to just be once a week, but now it's twice a week. And so kind of akin to, there's an example of if you put a frog in boiling water, it will jump right out. But if you put a frog in a pot of lukewarm water and kind of warm it up slowly, that frog doesn't register how hot it's getting and it won't jump out. So taking a second to assess how hot is the water you're in, particularly over the course of the pandemic, where I'm guessing a lot of workplaces have encouraged people to work harder, longer, more in order to serve the need. And I get why that has happened, and it can be tremendously detrimental to you and to the people you're serving. So there is a tough balance to strike there. So I have a few what I call work smart strategies. Certainly this nurse is employing one of them. This was her hard no after 2 beers. But And I'm going to cruise through them really quickly because I want to get to the last piece, which is the employer part, how employers can be really strategic in supporting workers. But just again, what kind of boundaries are you setting at work and with your clients or with whoever you're serving? How are you seeing the separation between yourself and your client or your work, or have you become that thing? I see that commonly, particularly in social services, where we ally so closely with our client that we don't see that we are a separate individual with a separate experience. Knowing what your triggers are, and then having an awareness of your internal state. So just like we saw those slides of the nervous system, kind of knowing how you're feeling at any given time, that may seem very basic, and it's not. I know many times during the day, I find myself not breathing deeply. And so having those opportunities to identify when you're not doing the best for yourself and then remedying them is important. Other strategies, coming to your work with attitude of curiosity instead of perhaps judgment, seeing our clients or our work as a teacher in and of itself instead of us having to know all of the solutions or having to try to control things we can't control. Our definitions of success. So are you again trying to create success in ways that you can't control? I know when I worked at a domestic violence shelter, oftentimes the public or even funders wanted to know how often did we get survivors of abuse to leave their offender. And to be honest, we never controlled that. That was entirely up to the survivor. And so if we bought into that definition of success, we were going to be really unhappy with ourselves. Now, the things we could control were, giving referrals or giving options or being kind and empathetic, giving someone time and listening. Those were things we could control. And I would guess within your work, there are similar attitudes where people want you to define success in a certain way that may or may not be good for you. And then I'm going to skip that slide because we're a little rushed on time here, not too bad. But I want to get to this employer role piece and talk about, certainly it is a kindness for employers to implement some of these strategies. And I would advance and say it's also their duty. If we're asking folks to provide these kind of services in really tough conditions, and relying on them to do so, and oftentimes I might add for not a huge salary, what can the employer do to protect you as a worker? And there's lots of things that can be done. So this is a really kind of dense slide as far as content. But a few that I want to pull out here are over in the right-hand corner, the one that says no martyrs. So what that's referring to is oftentimes the employee in the office that overworks, that sets themselves up for burnout, that stays 2 hours after work 3 times a week. Oftentimes that's the person that is then in some ways called out for terrific performance. And when you reward that kind of behavior, it sends a message to everyone else in the office that they also should be doing those things. And so then you create a climate or a culture that doesn't value folks taking care of themselves or folks, again, taking that path toward resilience. So it's not that on occasion, you may need to put in some extra time. That's understandable. But when offices really lift up those people as shining examples, and they're the same people that are not taking care of themselves, that's a real problem. I also want to really encourage what's called reflective supervision, particularly in social service and within healthcare. And I don't see it being used a lot in healthcare. It's being used sparingly in social services, but it's the kind of supervision that supports staff who are going through these kinds of challenges and creates a really safe, trusting space where people can bring the difficulties that they're going through and even sort through kind of why it's so impactful to them. So one of the issues about trauma is that if I witness a certain trauma, it may impact me really differently than if you witness the very same incident. And that's because we all have these different backgrounds. And so having this element of reflective supervision where people get the time to process what they're seeing is super important. Let me see if there's any of these others that I want to call out. Well, this educate workforce, what that's pertaining to is, how, when I was being trained to be a social worker within my social work master's program, there wasn't a course on any of this information. This wasn't even a part of any other course. And so I, through the course of my career have figured this out, and I got interested in it, quite frankly, because I got burned out. But what if this was a part of the kind of education that we deliver in the various professional schools? And also, as a supervisor, I would ask everyone who applied for a job, whether it was at a detox I was overseeing or a residential shelter or high utilizer program, I always asked at least a question about what they do to take care of themselves within this very difficult work. And frankly, I didn't care if they liked to ride a bike or if they collected miniature cars or they, whatever their hobbies might be. But from the very beginning, I wanted to plant the seed that this work is tough. And if you haven't found ways to support yourself, that is going to be encouraged. So there are these real concrete ways to build in the kind of support that's necessary. Even structural support for debriefing. So again, at many of the organizations I've worked at, it can seem like folks want you to, if they see you at the water cooler talking to someone, and now this was pre-pandemic, but if you're talking at the water cooler or spending some time with someone and it's not all quote unquote work related, that can be looked down on. And yet some of those moments that we're taking with each other to talk about what's happening, even if it's not super formal, can be really important, can be real supports to each other and help build connection and relationship within staff. So I think building in time for people to do that and occasions for people to do that is really important. So there are some other ones on here that are also, I think, really good ideas for employers and ways for them to make this real. I oftentimes think it's HR departments that really kind of connect with some of this material and the ways to implement it. And then I had a question that I saw for this particular presentation that I wanted to address as part of the presentation because I thought it was a terrific question. But it was about how do you create a culture shift where employers kind of embrace their responsibility around this? And I'll be honest, it can be difficult. And particularly if you're at a larger organization, kind of moving that big ship in any one direction to get anything accomplished can take time. But the ways that I've seen it work are, number one, for you to become educated. Attending this presentation is a good example of that. But you'll see at the end of this presentation, I have a resource list. And so there's other materials that you can read so that you know as much as you can about the topic. The second is for you to be an example So because your coworker wants to stay 2 hours after work every day, doesn't necessarily mean you need to. And so what does it look like for you to embody the steps necessary to be resilient and to choose that path? And then this next step is make the changes you can. So if you're a supervisor and you can implement some of these changes with your team, do so. And it's amazing how other teams or other departments will start seeing that success and over time mimicking it. And sometimes that's a better strategy than a strategy that I have used too often, which is going out there and telling everyone, oh, this is so great, you should do this, you know, and I'm not saying don't be excited about it or share it with folks, but sometimes it's really just about, well, go ahead and make that change in your team and see what unfolds from that. So then the last two steps, one of them, which I think works really well, is getting input from others about their experience. So that could be doing an interagency survey to see where people are with burnout, to kind of take the temperature of your team to see kind of how impacted maybe they've been over the last year and a half, where they are and kind of those symptoms that we went over. How much is that happening? Is it escalating? You know, once you have your arms around what the problem looks like, then it can be easier to convince folks that there's a remedy that's needed. And then finally is, you know, if you can find models of workplaces where you like the types of steps they've taken, or if you can find an expert or a consultant to help you on your journey, that can really kind of expedite things and get things moving. So I hope that answers the question that was put to me before this presentation. And then we'll just take a couple more minutes and then I'll open it up to question and answer. We're kind of
yeah, Kristen, yes. I was just going to say, yeah, just remind the viewers, if they have any questions for you, just submit those questions through the session Q&A tab in HOVA, and we can, you know, you can address those questions. But we have about 8 minutes left, so I'll give it to you again and step back. So thanks.
Terrific. And Melissa, do we have any questions yet? Because if
you actually answered the question that was out there, so yeah, good job.
Terrific. Okay. So this last piece is just, you know, we've talked about some of the harms that can happen to you from this like kind of beautiful work you're sharing with the world. And, you know, to look at the flip side of the coin is all of the beautiful things that can come to you from your choice of career. Because there are lots of terrific pieces about public health and social service work, and there are things that I have benefited greatly from in my life. And, you know, fostering these is also a way of, again, creating sustainability across your career. So, yeah, I mean, just the idea that we can do work that moves us, that we're passionate about, that helps people is so terrific. And what is also terrific, though, is once we reach the limit of what we can do, and again, sometimes that can come more quickly in a direct service environment, I've noticed, but it can happen in any job. But once you've hit your limit, to then also recognize that and know that there are other opportunities out there, particularly if it's starting to impact your physical health or your emotional health, you know, to know that that's also an option and it's okay. And then this final slide, I think, is so true. Again, this decision making, the work that you're doing is changing you. And it's like a wave. So it comes in and it goes out and it takes things away and it leaves things. And so thinking about you a year ago or you 5 years ago in this profession, do you like where you're headed? Do you like this trajectory? Do you like who you're becoming? And if the answer is no, how do you change or shift or transform that for yourself? But recognizing that our careers over time, really influence who we become, and the importance of having some awareness around that, taking a minute every now and then to assess it, and then going from there as far as what strategy you might want to use. So these are the resources that I promised you. There's also some self-care resources at the bottom that I really believe in, that have helped me. I don't work for them, but I think they're terrific. And this trauma stewardship book, Laura Lipinski has written a few books on trauma stewardship, and they are fantastic. So if you can get your hands on those books, they're wonderful. And then that's it. And if there's any additional questions, we can answer them now. But thank you all so much for what you do to make this world a better place. I really appreciate it.
Thanks, Kristen. Just want to thank you for sharing your expertise with us today. We appreciate all of your efforts towards creating a true health equity in New Mexico. And I want to thank all of you, all of our attendees for joining us today. Please remember to check out our event dashboard for more information about our upcoming sessions, including next Wednesday's presentation, Time to Make the Lemonade, Breaking Down Barriers and Reimagining Education Through the Equity Lens. And that's with Dr. Vicki Bannerman. So I just want to say thank you again, Kristen, and thank all of you, and have a great afternoon.
Bye-bye.